Good morning, everybody. Good morning, Bhubaneswar. Honorable Shri K.V. Singh Devji, Honorable Deputy Chief Minister, Odisha, Shweta ji, CEO, SUM Ultimate, my colleague, Dr. Pradeep Bhattacharya ji, Dr. Banambar Ray, Dr. Anand, my faculty colleagues from abroad, India, my nursing friends indulging in critical care medicine, honorable guests, delegates, media people, and dear students. I bring greetings from W4C Critical Care Foundation, Jaipur. It gives me extreme pleasure to see collaboration between three organizations: Indian Society of Critical Care Medicine, SUM Ultimate Medicare, and Indian Society of W4C Critical Care Foundation. It gives us immense satisfaction, also courtesy Bhubaneswar team, Dr. Banambar Ray and Dr. Anand Arya. And thanks and congratulations to Dr. Shweta for making it possible. I saw her at 1 a.m. at the venue previous to the conference, the day conference started, 1 a.m., personally supervising every single thing that was. Sir, we Critical Care Foundation, we see Indian Society of Critical Care Medicine as our parent. Our area of working is mostly to the second tier and third tier cities, towns, and rural areas of India. We think that 60 to 70% of India lives in rural areas. So let us focus on rural areas, and Indian society during last 35 years has done huge, tremendous work of galvanizing doctors, nurses, healthcare facilities to bring world-class standard knowledge, skill, education, and motivation to Indian doctors and nurses, and saved thousands and thousands of patients who otherwise would have to go to international centers, and saved a lot of money of their person and India. And we have made a huge progress. The membership of ISCCM grown from 23 to almost 20,000 today, and I'm proud of it. The journey of Critical Care Foundation actually started in 2021 during the COVID, and me, Dr. Banambar Ray, teamed up in collaboration with ISCCM and IMA to teach, train more than 35,000 medical professionals in management of COVID patients inside and outside the ICU. I'm sure we could save at least 10,000 patients through this campaign. Subsequently, we decided to extend our services, knowledge, and skill to doctors and nurses located in 2-tier, 3-tier cities, and we had we had first COVID conference online in which 1,500 doctors participated, and it was inaugurated by Sri Om Birla ji. We had second conference at Bareilly and Jim Corbett in 22. 23rd conference was at Jaipur last year, and this is the 4th conference. 5th conference is to be held in Srinagar, which is in focus these days. And I'm sure we will have a resounding presence of doctors and nurses hungry for knowledge and skill of critical care medicine, and to see the resurgent Kashmir, Hamara Naya Kashmir. So, and we have published a book on COVID and critical care, nursing critical care, a book on mechanical ventilation, and today we are going to launch a book on multi-organ failure in your presence, sir. I am very pleased to announce here that during the period we were doing research on toxicology, we found that WHO was showing about 250,000 deaths in India because of poisoning cases. And the data usually related to the urban population, cities population, and the rural data was absolutely missing. And by experience, now that we understand that majority of such deaths because of snake bite, our heritage, our living style, our rural agriculture-based economy and living style, most of these deaths occur in rural areas. And these patients had no support, no help, no medical skill, knowledge was available to them, and this data was not there. So Dr. Ray, me, and other friends decided that we should do something novel to help these patients so that they are all young parents, most of them, majority of them are between the age of 15 to 45. So we decided to launch an app. We had no funds, and I'm very happy and proud to mention here 20,000 rupees were contributed to by our doctors' members to construct that app, which is going to be launched tomorrow. And in that app, this is fully charitable. It will not cost anything to the patient, and there is a provision of all the knowledge about most poisoning prevalent in our country, and there is a provision for chat 24/7 between the patient side and our doctor side. And one of us will be on duty to respond to the calls of these patients 24/7. Most of us have a lot of experience in handling cases of poisoning, and I'm sure in coming times our rural population, colleagues, patients will have good reason to smile. Because we have time constraints, so I'll end my speech by saying a big thank you to you, sir. And I must mention that our focus of late is on nursing critical care. Because we produce lots of nurses, their plight is poor, and they have loss of confidence because of financial compensation is poor, the social and professional dignity is also missing. Therefore, we are focusing on nursing critical care, and we are running a campaign to teach and train them through Indian Nursing Council syllabus. We are engaged with Government of India, and our associate organization in Bhubaneswar is also engaged with Government of Odisha, and we are awaiting approvals. With this, I thank you all. Thank you very much for joining us today. Thank you.